Can you tell us about how you would explain PCOS and why it's called a spectrum condition?
So PCOS is polycystic ovarian syndrome, and it is a condition that causes problems in not just a woman's fertility and periods, but can cause other problems as well. We still aren't sure exactly what the cause is, whether it's like it's a chicken and egg situation. But basically, in women with PCOS, which is polycystic ovarian syndrome, they don't ovulate every month. That's the main thing. They do not release an egg every month. So women with PCOS are insulin resistant. So insulin resistant is a condition which is seen in diabetes, and basically it's this. What insulin should do normally, it should drive it should drive sugar cells, glucose cells, into blood cells. That is the role of insulin. So in someone with insulin resistance, that doesn't happen as well. So an analogy that I've used, I like to use, it's like you have a child, right? You ask this child to go upstairs. So if you say to this child, please go upstairs, and then they don't have insulin resistance, so they're not resistant, they will just walk upstairs, right? But if you have someone who's resistant, you say, go upstairs, go upstairs, go upstairs. Only on the 4th or the 5th go upstairs will they go upstairs. And that's what insulin resistance is. But at the end of the day, I think especially conception, it's something that doctors can try as hard as they want. But it's very much left up to the divine to decide who conceives and who doesn't. So don't be told, oh, I've got PCOS, I'm not going to have a baby. Don't think that at all.
Episode of the Founders Podcast, and we're bringing back Dr. Aysha Ziauddin, who was one of the most famous guests we've had. And in the sense, her podcast got a lot of reach, a lot of views, and we believe maybe it had resonated with a lot of listeners and viewers as to what she was talking about. So we thought, okay, we have to get her back again to talk more and delve deeper into female reproductive issues and problems and even concerns, right, Rishma?
Yeah. And also because that's what Sisterhood in Sri Lanka is about, where we're trying to talk more about hormonal health, which is very important and not spoken of so much here. And today, specifically, we are just going to introduce and get your minds dipped into the world of PCOS. So, Dr. Aysha, can you tell us about how you would explain PCOS and why it's called a spectrum condition?
Okay, so thank you so much for having me back on the show. That was a really kind introduction, so thank you very much. So PCOS is polycystic ovarian syndrome, and it is a condition that causes problems in not just a woman's fertility and periods, but can cause other problems as well. We still aren't sure exactly what the cause is, whether it's like it's a chicken and egg situation. But basically, in women with PCOS, which is polycystic ovarian syndrome, they don't ovulate every month. That's the main thing. They do not release an egg every month. So when you look at their ovaries, if they have polycystic ovaries on scan, it will look like ovaries with little cysts. However, it's really important to make it clear that when you have polycystic ovarian syndrome or polycystic ovaries on scan, it doesn't mean you have cysts on your ovaries. What you're seeing, actually, what the sonographer is seeing, what the doctor's seeing, and you may see when you look at the scan reports, look at the scan pictures, are little eggs that have started developing, but for some reason that we do not know why, they haven't gone on to fully develop and be released, i.e. ovulated.
Developing, but they're not being released.
So what it is it's immature eggs. So the main problem here is, for some reason, we don't know why yet, the eggs are not fully developing and they're stopping in development. And that's why women don't get periods, because there's a period. Remember, if I take you back to A-level biology, you only get a period, proper period, if you you've released an egg and you're waiting for pregnancy and pregnancy doesn't happen, therefore the womb lining is shed. That's what a period is. But if you don't have an egg being released every month, then you won't have a period every month.
Can you explain what's the difference between PCOS, PCOD, and endometriosis? All these technical terms we keep hearing about.
Okay, so I'll just go through what the abbreviations mean, the acronym stand for. So PCOS is polycystic ovarian syndrome, which is a spectrum disease with various symptoms. PCOD is an ultrasound finding where you polycystic ovaries on scan, yeah. And endometriosis is a completely separate entity where you have the presence of the lining of the womb in places where it should not be. That is what endometriosis is. They're generally not connected. They're two completely separate entities. So you ask about PCOS. PCOS is a condition which is very common. The latest figures say up to 1 in 4 women have it. So it's hugely common.
That's really common.
Yeah. And this is from the Royal College of Obstetrics and Gynecology. So
Yeah.
I haven't picked the her
And across
across the world.
across the world. Okay.
But it's more common in South Asia, for sure.
Really?
Yeah, it's more common in South Asia, and that's linked to insulin resistance, which I'll go into in a little bit. So basically, polycystic ovarian syndrome is a collection of symptoms, and we have quite strict definitions of what these are. So to have polycystic ovarian syndrome, you need to have 2 of 3 things. The 3 things being irregular periods, I think not having periods regularly, more than we would say. So oligo means less than 3 periods, 4 periods a year, and amenorrhea is when you don't have periods every 6 months. So you need to have that. You need to have irregular periods. The second thing you need to have is symptoms of high testosterone, so high levels of male hormone. And the third thing you would need to have is PCO on scan. So of those 2 things, I think one thing I'd like to address is people think PCO on scans, so polycystic ovarians on scans, means you have cyst on your ovaries. That is not correct. That's a misnomer, we say. What basically PCO is polycystic ovaries is that's what it looks like when you scan. So if you look at the pictures of your scans, or if you look online for polycystic ovaries, you'll see basically a picture of an ovary with lots of little follicles, we call them. And what it is basically with PCOS, for some reason, and we still don't know why, every month, normally, egg will develop, get bigger and bigger and bigger, become a dominant follicle. It will release an egg, ovulation, and that's what happens every month. Sadly, for some reason with PCOS, and we still don't know why this is, that process stops. So instead of an egg getting bigger and bigger and then becoming dominant and being released, it stops doing that. So that is why when you look at an ovary with polycystic ovary disease, it just looks like it's got little cysts. They're all little eggs that have not developed.
Person who has PCOS can go on to have PCOD, or is it like completely?
So basically, generally, when you have polycystic ovaries, some women have polycystic ovaries when you scan them, but they have no symptoms of PCOS. So they have regular periods. They don't have any of the symptoms of high testosterone. So they would not have PCOS. It's the people who sometimes have normal ovaries on scan, but still have irregular periods and high levels of hormones, of male hormones, that they've got PCOS.
Okay. What's the difference between PCOS and then PCOD? Then you were talking about the scan.
So PCO and so in our medically we don't see a difference between PCOS and PCOD, but we say a difference between PCOS and PCO. Yeah. So PCOS is the syndrome, so all the different symptoms together, and PCO we would say it's a symptom of that.
Okay.
The polycystic ovaries is a symptom
Yeah.
of the
Disorder and syndrome isn't something we as doctors generally look at.
So I've been diagnosed with PCOS, and I was told that no, that you're not PCOD, but you're PCOS, and
Okay.
I've got endometriosis. So which is why we thought it is useful to look at this distinction. But now that it sounds like there's new information that's coming out, and that's very helpful. It's clarifying even our understanding of it.
So, like I said, especially in a formal gynecology, we don't, talk difference between PCOS and
Okay.
PCOD. And I checked with even the Royal College, which is generally for like British-based doctors, sort of the pinnacle of gynecology, and they don't see a difference between it. PCOS and PCO, obviously there is a difference, but PCOD and PCOS is disease and syndrome for me, there wouldn't be one. It's
So
just the same, like it's a spectrum. You can have severe symptoms with PCOS, you can have mild symptoms with PCOS. But that's what a syndrome means. It's lots of symptoms
Collection
together.
of. Okay.
okay,
Yeah.
that makes sense. So what is the earliest you can get diagnosed? Like in your teenage years as you start having your menstruation, or like it takes time for actually people to realize they are
So the
PCOS?
problem when you're a teenager is that most teenagers, as soon as they get their periods for the first time, it does take a few years for your periods to regularize. Lots and lots of young girls will have irregular periods as soon as they attend age because their body hasn't just got into the pattern of ovulating properly yet. You shouldn't really, we wouldn't really say someone has PCOS if they're like 12, 13 and they're having irregular periods. However, if they are having other symptoms, then we look at it differently. It is normal at the first few years of your like adult reproductive life that you have irregular periods. So we would generally say it's a little bit older, 16 onwards. If you got your periods at 10, it would be a little bit older that we start diagnosing PCOS.
But why is it that like a lot of women like them wait for years? Like a lot of the stories start with like, okay, maybe in their 30s or late 20s and realize like, oh, we've been suffering with PCOS. We just realized, right? Why is it hard to diagnose, or is it just
So
too complicated?
PCOS, in my experience, and the research shows that PCOS is generally because it's quite like, so I am not getting a period for 6 months or 3 months because it's quite a objective thing. Yeah. It's generally investigated, but it was more with endometriosis that women have to wait years and years and years for a diagnosis. They say, the research I read today said it can take up to 10 years for a woman to be diagnosed with endometriosis from start of her symptoms to a diagnosis.
Wow, 10 years?
Because because endometriosis is like I've got painful periods. So, and often if it depends which doctor you're going to, if you're going, sometimes if a woman says she has painful periods, she's told, well, that's normal, suck it up to them. But obviously, if a woman has endometriosis, it's not just a painful period; it's an excruciating. It can be an excruciating period in which you can't function. But then pain is a very subjective experience, isn't it? So therefore, that can be the delay especially with endometriosis.
Actually, right here, it is Rushma who would have the best inputs, because she would bring in her own personal experiences where it took her quite some time, wasn't it, Rushma, to be diagnosed, actually, saying what, six, now she's using 6 years to be diagnosed as PCOS.
Or with PCOS, but then did you have the
Is your
symptoms of or the endo?
Endo. It was the endo. It
Yeah, that
was
that 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 fits.
and
yeah.
the PCOS I had been diagnosed about, I think, 10, 15 years ago. And along with that was, I had really, really bad, painful periods where you couldn't function. So
Hmm.
then over time, and now you're like, "Oh, look at the tissue, it's growing outside over here." And guess what? You got endometriosis. Like, oh, okay.
So one can develop into the other.
They're separate entities. Uh, it's just like it's just sadly bad luck really to get both endo and PCOS. To my knowledge, there hasn't been a link between PCOS and endo. It's just they're two very common gynae conditions. So so like endometriosis is the presence of the lining of the womb outside the lining
Right.
of the womb.
Yeah.
So you can get it anywhere in the pelvis, so anywhere like on the ovaries, on the fallopian tube, or you can even get it outside. Like in very rare cases, people have nosebleeds every period because there's endometrial tissue in their nose, in
Okay.
the nose,
Wow.
and they have nosebleeds every month. It's rare, but it can happen. It's been seen.
Easy. Interesting story though. So, but is when you're coming back to PCOS, is it a reproductive only issue, or is there like some other issue, like metabolic issues that are related to it that can cause it? Do we
So
actually
it's a very
know?
it's very much
Later.
chicken and egg situation, right? So women with PCOS are insulin resistant. So insulin resistant is a condition which is seen in diabetes, and basically it's this. What insulin should do normally, it should drive blood cells. Sorry, it should drive sugar cells, glucose cells, into blood cells. That is the role of insulin. So in someone with insulin resistance, that doesn't happen as well. So an analogy that I've used, I like to use, it's like you have a child, right? Do you want to go? You ask this child to go upstairs. So if you say to this child, please go upstairs, and then they're like, they don't have insulin resistance, so they're not resistant, they will just walk upstairs, right? But if you have a child, if you have someone who's resistant, you say, go upstairs, go upstairs, go upstairs. Only on the fourth or the fifth go upstairs will they go upstairs. And that's what insulin resistance is. It just takes so much more insulin to get that glucose into the cell.
And
Have I
somehow,
explained it in a way that makes sense?
yeah. So once you develop that, it affects your.
So for some reason, women with PCOS have insulin resistance. And we're not sure if it's the insulin resistance causing the PCOS or is the PCOS causing the insulin resistance. That people just not sure about that. So what we do know is if you have PCOS, the chance of you getting diabetes, for example, is so much higher than someone who doesn't have PCOS.
Is
The
it
risk.
something to do with, sorry, Dr. Aysha, is it something to do with hormonal change that is caused by PCOS or whatever?
So that thing, we're not sure. We're not sure if which causes what. We're not sure if it's because you have a propensity to
Yeah.
be insulin resistant and be diabetic, you have PCOS, or is it the PCOS that's causing the hormonal imbalances, therefore causing you to have the pre-diabetes and diabetes. It's just a lot of uncertainty, but that is why when we're treating PCOS, we often treat insulin resistance as well.
You
So they go hand in hand.
so you will develop diabetes.
Not you will. The chances of you developing diabetes is a lot higher. But it also, it's like if your parents are diabetic, which sadly mostly in Sri Lanka, which it's very rare to find someone whose parents are diabetic here. Because it's like another risk factor. And
Does that
also, but then also women with PCOS are generally have a little bit more overweight or obese. That also does, add on to the risks as well.
is that why like sometimes some of the course of treatment is about taking metformin?
So metformin is an interesting drug. Metformin actually is a diabetic drug. The research, if you look at the research papers, it says that metformin doesn't actually help with PCOS. However, anecdotally and in my practice, I have seen that it's the thing that I think is really important for your viewers to know is that if you are not having bleeds with PCOS, that means your lining of your womb is getting thicker and thicker and thicker, right? And that can be a risk factor for endometrial cancer. Okay. So if you're not having a period and it's been 3 to 4 months, you should be going to a doctor and you should be getting hormones or progesterone. You have it for a few days, about 4 or 5 days, you stop it and then you will start bleeding. So that's quite important that no matter what lifestyle methods you're doing, it's fantastic that you're doing lifestyle medicine. You might be anti-medicine, you might be anti-Western medicine, that's fine. But you need to be having a bleed every 3 to 4 months, which is quite important.
Because I mean, like a lot of people look at bleeding as like a annoyance or a bad thing, and even like if you're playing sports, right? I think there's like a lot of trend also for among some women to like take birth control pills either for like skin issues or to manage sports. They don't want to bleed and things like that. Do you think that is just making them worse off?
So it depends. If you're on the pill, if you're on the combined pill and you're having progesterone and estrogen together, then you're okay. Because basically the issue with polycystic ovaries, ovarian syndrome, PCOS, is that you don't have enough progesterone, right? So you have a lot of estrogen, which is you have a lot of estrogen. It's a very estrogen dependent condition, but you don't have enough progesterone. Now, progesterone is what's important. Progesterone is what protects the womb. So if you're on the combined pill, if you're on Mithri or you're on Yasmin, you've got both those hormones. So your endometrium is being protected. Your lining of the womb is being protected by the progesterone. While women with PCOS, they don't have that. They don't have the progesterone. So that is the issue.
So there can be a lot of confusion, right? Because birth control, I think, is one of the kind of solutions they give to manage PCOS also.
So birth control is very interesting. If you're on birth control, it's maybe off the topic, but it's interesting perhaps. So birth control was invented in the 60s, right? The 1960s. And initially when it was formed, it was seen as very, very taboo because, women, they thought it did open the sexual revolution, but it also meant that women were more free in having sex. So obviously, if you think about society then, that was considered a very bad thing. And therefore, the whole 21 days on, 7 days off, how you take the pill, that's only for social reasons. That's only to show people that you're not on the pill. That is the only reason for it. So medically, there's no reason why you need to be on it for 21 days and stop for 7 days. Because of the progesterone, your womb is protected. Because remember, when you're on the pill, you're not ovulating. It's not a period. When you're taking the pill, that bleed you get is not a period. It's a withdrawal bleed. It's because you've stopped the progesterone. That is why you're getting a bleed. So
Yeah,
that
yeah.
21 days on and 7 days off is just to show the world you're not on the pill.
So they could take it.
Now you can take it. So the only thing is if you take it for 2-3 months, if you take it for 2 months continuously, it's fine. If you take it for 3-4 months, you might get a bit of spotting. So having that 7-day break isn't a medical thing.
So
But that is only, it's mad, right? But that's only if you are on the combined pill. Yeah. So in Sri Lanka, it's very sad. We don't have the progesterone only pill. It's available everywhere else in the world. I used to use it a great deal in England. That pill you have to be on every day. There's no break because it's progesterone only.
does it
So,
have like a side effect? Just only taking progesterone? Is it
so some people do have a bit of slightly irregular bleeding with it, or some people do. That's the main one. But in Sri Lanka, people have the injection
Yeah.
and the injection. So that's the similar hormone. So some women who have the injection, they don't have periods.
Yeah, yeah. I mean, I got it once, but then for a whole year, I was sharing personal experience. But like, I didn't have a period for a whole year, and then suddenly it came on, and it was like all over the place, like continuous periods for like 2-3 months, like that.
Oh, really? That's having
Yeah,
with the injection.
yeah,
Yeah, so some women don't do well with it. It's like the Marina, the Marina people use here as well. Again progesterone. So some women, a lot of people have no bleeding with it at all, or some people have very light bleeding. But some people, some people don't react to the progesterone that well. But the point is, like, with the combined pill, a whole 21 days, 7-day off is a social contract. Was to appease the Catholic Church.
I just want to know, like, people, at least younger women who are like maybe unmarried, when they come for PCOS diagnosis and you suggest birth control or something like that, um, do they feel a bit like taken aback? Like, some people might, not want to take birth control pills?
I think as if you explain it to them. So the thing about birth control is, and what like the influencers say, oh, it doesn't look at the root cause. No, it doesn't, but it helps with a lot of the really annoying, symptoms. So, it protects your lining of the womb. It can give you regularity of periods if you're having irregular periods. Yasmin and Dinah are very good for helping with the acne and the hair, the excessive hair that you get with PCOS. Earlier we spoke about, I said the symptoms of PCOS, one of them is excessive male hormone. And what excessive male hormone gives you is the acne, the increased hair on your face and your body. So those are quite upsetting symptoms. And the pill can really help with those. So yes, it doesn't look at the root cause, but it really does help with the symptoms of PCOS, which we shouldn't discount. But I explain that to my patients I always offer them the pill when they come for that reason.
Yeah. Um, but okay, so one thing, then we move on to treatment, right? How we treat it. One is like the medical way of treating with birth control pills and things like that, hormone balancing. And the other, I could say, influencers said, lifestyle changes and other concepts like seed cycling and things like that. So, what do you think of?
What cycling seems like? Yeah, so I am actually a lifestyle medicine doctor. Like I've just completed my diploma in lifestyle medicine. So for me, lifestyle medicine is actually very important. So any condition, you need to change your lifestyle um, to treat it. And the thing about PCOS is it really does need huge lifestyle. It really does need you to put emphasis on your lifestyle. Um, And I have seen women, who've done that and they've, gone on to really improve their symptoms. But sometimes you do need a bit of help with the tablets as well. So it definitely is twofold. You can't. Some women are very light, like who are very mild PCOS. They can just do their lifestyle and that's it. They've had their children and that's fine. But if you've got more severe PCOS, and when I mean severe PCOS, I mean like, you have no periods or you have very high levels of testosterone or, you're really struggling to get pregnant. Those women may need a hand with whatever from a medical point.
Like starting off, you can change lifestyle and at least
It's
manage
so
it.
important. Like it's very difficult otherwise. It's, if you just say to somebody, here's some metformin or here's the pill, for example, if you give them the pill, yes, their symptoms may decrease, but say they still have, they haven't changed their lifestyle and they're on the pill, that's fine. But once they stop the pill and they want to have children and they're still living a PCOS unfriendly lifestyle, then it can be more.
It can worsen.
Well, it's more. It can be, your risk of diabetes or it's. I think the big thing for women with PCOS is fertility, isn't it? That's what concerns women mostly. So that, it can be more difficult to conceive.
Okay, so that comes to my question is, can it be reversed or like, made better, kind of
So you can
improve,
manage it.
manage it?
You can manage it with your lifestyle and with medicine. The most, when I have patients who are upset about their PCOS diagnosis, I always say the most famous person with PCOS is Victoria Beckham, and she has
Have like
so
4 kids.
many children,
Yeah, 4
and
or
she's so
5.
thin. But she was diagnosed with PCOS. But I think that's when. So she was diagnosed with PCOS, and then she said she went on a certain I think she went on she went on like I think a low carb diet, and then she conceived her children. So
Okay, so that's one way. I don't know if we can survive the low carb diet, but
it's very hard in Sri Lanka, and actually it's very hard to maintain as well.
yeah,
I would say that the jury's out. In the medical world, the jury's out whether the low carb diet, is it a friend or a foe? So if you ask doctors, each doctor has an opinion, and then even in the research is very difficult because there's one band of papers that say low carb is the way to go, and there's another band of papers which equally as RCTs, so a randomized control trials would say, well, actually, no, a plant-based diet is far better. So it's the jury is very much out in the medical world as well, to which is the best for people.
how is it in Sri Lanka? Like when we diagnose PCOS, how the treatment, how the prevalence, like how we manage it, is it still like are people like they understand it?
I can't speak for my colleagues. I can only speak for myself.
No, like patients.
Uh, Patient. All right. People are very aware now. I think especially the younger generation, Gen Zs, they have researched so much before they come to you. And they're very on the ball. Very on the ball. One thing I would say is that when it comes to medicines and things, as I've been a Western medical doctor for 20 years now. Well, nearly 20 years. I qualified in 2007. So, but what I realized in these 20 years is that the more I know about Western medicine is that there are other forms of medicine that exist as well. And just because I, as a Western medic, don't understand it, doesn't mean it doesn't work. So, like Ayurveda, Chinese medicine,
Yeah,
Nami medicine, these things have been around for thousands of years.
yeah,
So, you shouldn't discount them either in treatment.
true. Because I mean, one thing we came across is that um, there's more research done on pigeons than menstruation, apparently. Which
I'm not surprised. I'm not surprised.
so
We spoke about it last time as well, didn't we?
yeah,
That women's health is just not bothered. And like even that's why it takes so long with endometriosis, because when women are coming and saying they've got really, really painful periods, often people, could be just discounted, or if you tell, they might say, well, that's your periods are painful, too bad, which isn't
yeah,
fair.
yeah, and okay. The one big issue, well, two big issues actually, we want to end with, Dr. Aysha. One is, can you hear me?
Yes, it's fire.
Yeah, two big
Oh,
issues.
it's better now. Yeah.
Yeah, one is infertility or fertility issues. and the other is weight gain. Two things that women with PCOS, I think, worry about. How do you recommend that they manage these two? I mean, let's start with fertility. Like,
Okay.
you have to be worried.
So fertility, I think if you've told you have PCOS, yes, you do worry will ever have children. But it's very hard to predict how much it will, give you an issue. Some women have PCOS and go on to get pregnant the next month. And some women obviously do need more help and need maybe ovulation inducers, which is called clomiphene, letrozole, and some women need IVF as well. But then that is also the same with people who don't have PCOS. Unexplained infertility accounts for 1/4 of all people who have problems getting pregnant. So you can't.
Getting pregnant itself is hard.
Well, it's 89% of couples who've been trying for 2 years will get pregnant. So it's not. But then if you have PCOS, is a hard. You've got married and you're 28 and you think, you know what, I want to have kids when I'm 35, but
Yeah.
you have PCOS. I would say that's maybe not the smartest, thing to do. Start thinking about it maybe earlier. Like, obviously, when you get married, especially in our society where we potentially don't know our husbands as well, it could be from arranged marriages and things. I would say wait at least a year to get to know that person and like solidify your relationship and then start trying. But if you know you have PCOS, don't wait till your mid-30s to start trying if you can avoid it. Obviously, if you're not married, then but that would be my advice. Well, to be fair, that would be my advice to anybody, but don't wait till you're in your mid-30s if you know.
Yeah, because I'm guessing the egg release problem is going to get worse as they're going to
Well,
have
it's
less
not
eggs.
necessarily like you need time. Like, as we get older, our egg quality does reduce. There's no way around that.
Yeah.
So, if you know you're going to have, if there's a chance of problems, then it's better sort of start earlier than starting later. I'm not advocating, I'm saying if you're 20, I'm not advocating people saying, oh, look, the doctor said we've got married for a baby straight away. I'm not saying that. I'm saying,
Yeah.
what happens here. No, but I mean, like,
But the
if you
important thing is that it's not like the end of it all, right? Just because you have
no,
PCOS,
like
you're not.
not at all, not at all. Like I said, you never know. But at the end of the day, like, I think especially conception, it's something that doctors can try as hard as they want, but it's very much left up to the divine to decide who conceives and who doesn't. So don't be told, oh, I've got PCOS, I'm not going to have a baby. Don't think that at all. Just think if you're 30 and you want to wait, you're married and you want to wait to 35 to have kids because I don't even travel the world, and then just start thinking, should I be doing that? That's the only thing.
Yeah. And finally, the big issue, weight gain. How do you manage that?
It is hard with women with PCOS. It is harder than for others. But there's certain things to do. Like, for example, we know that the research saying that HIIT maybe isn't the best for women with PCOS because it affects cortisol levels, and maybe moderate exercise is better
You're
with
saying
strength training.
HIT.
Sorry, high intensity interval training, which was all the fad maybe 10, 15 years ago. Maybe isn't that great for PCOS. But the main thing is movement. It doesn't matter what you're doing, move.
Yeah.
But strength training is really important. And the reason why strength training is important from a medical point of view in the PCOS setting, there are loads of reasons why, but in a PCOS setting, when you increase muscle mass, more sugar goes into cells. So it increases insulin sensitivity. So that is why with PCOS, weight training is actually quite.
Yeah. So that's a good note to end with. Rushma, do you have anything to add?
I just want to say thank you. Thank you so much, Dr. Aysha, for addressing this, because one of our main core thing is about hormonal health and lifestyle changes with the support of medical assistance, to have a more content life, for women sufferers with, either PCOS, PCO, or the endometriosis. So we really,
No,
really
and
appreciate this talk.
endometriosis
It's a separate conversation altogether.
Yeah. And it affects women's life so badly. Like your quality of life with endometriosis can really, really be affected. So I think it's definitely worth giving it its own conversation.
Thank you.
Thank you so much.
Zara.
And don't forget to subscribe, like, and share the video.
Yes.
Here.